Good morning and welcome to Trevor Phillips on Sunday. Tomorrow was billed as Freedom Day. Nearly all coronavirus restrictions in England are supposed to be lifted at midnight tonight. But based on the last 24 hours, it'd be a brave person who predicts exactly where they'll be and what they'll be doing this time tomorrow. Ironically, the one person who does know where he'll be is the Health Secretary. He won't be getting on the bus to work. He's holed up in the back bedroom after testing positive. The Prime Minister, though, won't be isolating despite being a contact. He'll be participating in a test and release trial. But that won't apply to potentially millions of others. With cases going up sharply, many people may wonder if it's not just the branding around Freedom Day that needs to change, but the policy. The previously irreversible Boris Johnson may not quite be reaching for reverse gear yet, but how long will that resolve last? Well, in just a few minutes, I'll be putting that question to Local Government Secretary Robert Jenrick. We'll be getting the Labour view with Shadow Health Secretary Jonathan Ashworth. Social care is a major issue in the government's in-tray. Former First Secretary Damian Green reckons he has a potential solution, and he'll be telling us about that. It's Nelson Mandela Day. We'll be speaking to the great man's daughter, Dr. Makaziwe Mandela, and we'll be looking at interesting results from a poll of business leaders speaking to Chartered Management Institute boss Anne Francke. But first, the original plan was for us to be joined this morning by Sajid Javid, but after the Health Secretary tested positive, a last-minute substitution was made and his colleague Robert Jenrick, the Local Government Secretary, has come off the bench. He joins us from Birmingham. Thank you for joining us in place of your colleague this morning, Mr Jenrick, who, despite being tested positive for COVID, is now self-isolating. Let me just ask you this. We just got the statement a few minutes ago about the Prime Minister's situation. It says that the Prime Minister and Chancellor will be participating in the daily contact testing pilot to allow them to continue work from Downing Street. Now, when the Prime Minister talked about Freedom Day, did he just mean freedom for him and the Chancellor and other Cabinet colleagues, and not for the millions who are supposed to go to work but won't be having access to that pilot?
Well, good morning, Trevor, and thanks for having me on the programme again. You're right to say that the Prime Minister and the Chancellor were contacted by NHS Track and Trace overnight, which shows that the system is working. They're going to take part in a daily testing pilot, which is available to a range of organisations, not just to politicians. It's being used by Border Force and by the Transport for London that runs the tube in London, for example. And that means that they can conduct important government business, but they won't be able to go out socialising or meet other friends and family. So they'll have to limit their contact with other people as much as they possibly can. But to your broader point, we do believe that we're able to move forward tomorrow with stage 4 of the roadmap. That's really for two principal reasons. The Prime Minister set two ambitious targets earlier in the year. Firstly, that we wanted to ensure that 2/3 of the adult population of the country had been double vaccinated by this point. And secondly, and just as importantly, that every adult in the whole of the United Kingdom had been offered at least one vaccination. And both of those tests have been met. So that does mean that we're able to move forward, but we'll be doing so very cautiously, Trevor, because as you note, cases are rising, hospitalisations are rising, and so we're all going to have to exercise personal responsibility and informed good judgment in the days ahead.
Can I just bring you back, Mr Jenrick, to the question I asked you, which is about this pilot, which the Chancellor and the Prime Minister are part of. And as I understand it, Mr Gove, when he had a similar problem a little while ago, suddenly also found himself part of a pilot. Now, these pilots are supposed to be random. Is there a Cabinet Minister who won't have the luck to be a subject in this pilot if he or she is pinged?
Well, this is a pilot, as I said, that's being piloted by around 20 organisations within the public sector, including Border Force, including Transport for London. It's correct that the Cabinet Office and Downing Street are part of the pilot. I'm not aware that other government departments are. It means that you can be tested every day in specialist asymptomatic testing centres, such as the one that's been set up in Downing Street. It means that the Prime Minister and the Chancellor will be able to conduct the most essential government meetings, but the rest of their time will have to be spent isolating and not, as I say, meeting up with family or friends or socialising in any other way. So it's relatively restricted.
Thank you for the...
I entirely appreciate your point, Trevor, that this isn't available yet to wider members of the public, and I appreciate the frustration that they might feel listening to this. They, like me or other members of the public who are pinged, will have to self-isolate in the usual way, and that's a really important part of our plan to keep COVID under control.
Okay. I get that, and I appreciate you just said that if you were pinged, you'd have to self-isolate, but there's no evidence that that's what happens. You can see what it looks like. It looks like one rule for them and one rule for the rest of us.
Well, as I say, this is a pilot that's actually being used by around 20 organisations, so hundreds, if not thousands, of public sector staff who work in those organisations will be able to use this pilot. We'll be learning from it, and of course, if it's possible to roll it out more broadly because it's proven to be safe and successful, then we will do. But for the rest of us who are not yet part of that pilot, the crucial advice is, if you are contacted by NHS Test and Trace, to take that very seriously and to self-isolate, because although it can be frustrating, that has helped us to prevent thousands of cases. A study from the end of last year showed that Test and Trace had prevented 600,000 cases and 8,000 unnecessary deaths in just a 3-month period leading up to the end of last year. So it is an important tool in our armoury to tackle the virus right now.
One last point on this, if I may. Do you happen to know who decided that Downing Street would be on that list?
No, I don't know, Trevor, but as I say, it is just one of several large organisations, some much larger, like Border Force and TfL, that employ many thousands of public sector employees. If the pilot is proven to be safe and successful, then I'm sure it will inform steps that will be available to the wider public. And remember, of course, that within 6 weeks, we do anticipate self-isolation changing. So in mid-August, the plan at the moment is that those people who are double vaccinated, and by then it will be the overwhelming majority of the population, won't need to self-isolate in the same way that they do today. And from tomorrow, the school bubble system will be retired. And so that will also make it easier for members of the public. I appreciate it's been very difficult, very challenging indeed for many schools in recent weeks, particularly the last fortnight, where the number of young people having to self-isolate as a result of bubbles and NHS Test and Trace has been considerable. That will improve from next week. We'll then go into the school holidays, and from mid-August we anticipate we'll be able to move forward for the double vaccinated to a different system.
I want to come to vaccination of children in a moment, but let's follow what you've just said. Last week, 500,000 people were pinged. Estimates out this morning suggest that up to 10 million people might be pinged in the coming weeks. Is what you've just told me that the government is clearly heading towards a situation in which fewer people are likely to be pinged, or that we might lift the self-isolation regime, for example, as the former Prime Minister Tony Blair suggested this morning, that people who are double jabbed would not have to self-isolate? Is that what's in prospect in next month?
Yes, it is. We've already said that we want to get to a point by the middle of August whereby those people who've been double vaccinated wouldn't have to self-isolate in the same way. They would take tests and have to follow all of the testing requirements, but they wouldn't need to self-isolate in the same way. And that will be a significant step forward. The reason that we've chosen to wait until mid-August is to ensure that we get even more people double vaccinated, because we know with the Delta variant, that one vaccine is good protection, but two vaccines is very significantly better in preventing both transmission and serious illness and death. And so by waiting that extra 6 weeks, we should get to the point where a very significant number of additional people, particularly the younger people in their late teens and 20s who have been later to the vaccine programme, have been double vaccinated. Myself, for example, I've got my appointment next week to be getting my second vaccine, and so by waiting a bit longer, we get much more of the population into that category. That is the decision that we've chosen to make. Obviously, we'll keep that under review, but we expect by the middle of the month to be moving to a somewhat different system, which will be less restrictive and easier for people to manage. But I do appreciate that this is proving to be very challenging, obviously for schools, although they are about to go into the school holidays, but particularly for businesses and public services across the country.
Everybody understands that the government is trying to make a judgment between the progress of vaccination and the speed of and variation in the virus, and it's a hard judgment to make. But let's test this out a little bit. Let's start with the issue of people who have been double jabbed, like the Health Secretary, who have now contracted COVID. What percentage of people currently in hospital with COVID have been double jabbed, do you know?
I don't have those figures, Trevor, but what the Health Secretary's case does highlight is the fact that although the current set of approved vaccines are very good at helping people to avoid serious illness and death, there's no full safe vaccine that can provide you with 100% protection. What the current vaccines do is ensure between 80 and 90% improvement in the likelihood of getting serious illness and even greater improvement in the likelihood of death. So they take what is otherwise a very nasty disease, which can lead to serious illness and death, and turn it into something that the overwhelming majority of us should be able to withstand. But they don't provide 100% protection, and that's why I say again, despite the fact we're moving into the next phase of the virus and it's right to do so, we will need to do so with great caution, and each of us, particularly the most vulnerable, continue to show personal responsibility and judgment in protecting ourselves, our loved ones and the wider public.
I get that, but let's just get clear on what basis you're making these judgments. Not very long ago on this programme, the former Health Secretary, Matthew Hancock, told us that the majority, or the vast majority, I think, overwhelming, I think is the word he used, majority of people who are hospitalised were not double jabbed. What he suggested to me was that actually being fully vaccinated provided pretty much complete protection against the virus recurring or being passed on. Is that still the case?
It is still the case. The being vaccinated with our current set of vaccines provides you, as I said earlier, with between 80 and 90% protection.
Still the case. Why not let people who are double jabbed be exempted from self-isolation?
I'm sorry, I didn't hear that question, Trevor. There's quite a lot of background noise here.
If what Mr. Hancock said is still the case, why are you not exempting people who are double jabbed from self-isolation? Given the economic and problems and the chaos, frankly, that the amount of pinging that's going to take place will cause this country.
Well, we've chosen to wait a short period, 6 weeks, on medical advice, which is to ensure that even more of the population get double vaccinated. That has two effects. Of course, there's a question of fairness, because that ensures that younger people can be double vaccinated before something is opened up to those who are more fortunate and have been able to be vaccinated sooner because they were older or more vulnerable. It also means that by having more people double vaccinated, transmission will be reduced within wider society, because of course a vaccine doesn't just protect yourself, it helps to a lesser extent, but nonetheless an important extent, to protect other people by reducing the risk of transmission. So it was a precautionary step I appreciate that, but one that we took on the basis of the medical and scientific advice that by the middle of August, we'd be in the position where a much larger number of individuals, particularly amongst those in their 20s, who statistically are more likely to be out socialising, meeting other people more regularly, more of those individuals will be double vaccinated. I think that's the right thing to do, but I do appreciate that it will produce some further disruption and frustration in the coming weeks. But I would, again, urge people to ensure that they do have the NHS, the app on their phones, that it's fully switched on. We're seeing actually more people downloading the app than ever before, so the evidence is positive. But then if you do get contacted by Track and Trace, of course, to follow all the steps that are required, because it is a really important part of our toolkit for tackling the virus at this critical stage, as cases are still rising, hospitalizations are increasing, and we won't really expect this wave of the virus to peak until late August, maybe even early September. So there are going to be some quite challenging weeks ahead.
Mr. Jenrick, 2 points. First of all, you've been clear that actually there's a lot of stuff there are a lot of things we don't know and we can't be certain about, and everybody knows that. Secondly, you've used the word caution or precautionary, I think now half a dozen times. I've been noting it during this interview. Why are we still going ahead with Freedom Day tomorrow?
Well, as the Prime Minister said earlier in the week, there's no easy or straightforward answer to the question of when we should move forwards and move from a system of legal requirements to one of personal responsibility. But now does seem like the logical time. We're moving into the summer holidays for school, which will mean there'll be less transmission amongst young people and families. The weather is good, and so that is the most benign climate for tackling the virus. And we modelled what might happen if we were to delay for another short period, for example, till September, and there wasn't a compelling case to do so. So now does seem like the right time to move forwards, but we have to be honest with the public that cases are rising. As I say, we haven't yet reached the peak of this wave of infection. And so we all do need to approach this carefully and cautiously and in a gradual way. And we will all need to exercise good judgment. We are moving from that time where the state told you what to do, things were mandated as a matter of law, to one which had to come at some point where we trusted people, we trusted businesses and organisations, and gave them the information they needed to make good judgments.
All right. Can I just be frank and say, I understand all of that, but I think that some people will feel that what you're really saying is that the government is essentially being blown by the course of events rather than having a plan. Now, there could be some very specific things that you could say we're definitely going to do. For example, you could decide, as have several other countries, United States and Israel, to vaccinate children. And that would make sure that we reduce the circulation of the virus and the possibility of more variants. Why not?
Well, firstly, Trevor, we do have a plan, and that plan, fortunately, is working. We set out that we would vaccinate by this point. In fact, we've done it earlier than we said we would do, 2/3 of the adult population with 2 jabs. We said that we would ensure every adult in the whole United Kingdom is offered
I just asked you about
at least
children.
1 jab. We've managed to achieve both of those two things.
Yeah, I've just asked you about children rather than adults. I wonder if you could deal with that.
Understood. Understood. Now that we have offered the jab to all adults, and of course there are still some that need to come forward, I'd strongly urge them to do so, we will be taking advice in the coming days from the JCVI. We haven't yet received their final advice on whether to extend the vaccine rollout to children. That seems like a sensible thing to do. And so we will be looking carefully at their advice when we receive it. We expect it very soon on whether or not we should open up the vaccine programme in the first instance to those children who are just short of their 18th birthday, to those children who have particular vulnerabilities and those children who are in households where there are people who are particularly vulnerable. That seems like a sensible way for us to proceed, but ministers will need to make that decision when they're armed with the final advice from the JCVI, our expert advisors. And as I say, I expect that we will be receiving that advice very soon.
OK. Mr Jenrick, before we finish, can I ask you to return to your normal position on the pitch in the team, and that is, as local government minister, you are one of the two secretaries of state responsible for social care. The Prime Minister said on the steps of Downing Street on the moment he became Prime Minister that the government had a plan prepared which it would reveal for social care. He will have hit 2 years as Prime Minister in the next few weeks. When are we going to see that plan that was prepared 2 years ago?
Well, the Prime Minister intends to honour that commitment. We've said that we're going to bring forward a plan before the end of the year, and I expect it will be published much sooner than that. We're working intensively on it. As local government secretary, of course, I play a role in that, also the health secretary and the chancellor. So you won't have to wait very much longer. As local government secretary, I know how incredibly important it is that we put the financing of social care on a sustainable footing. It's been tested very severely over the course of the last 15 months. People who work in the sector have done an absolutely magnificent job, as have local councils, in keeping it going. But now is the moment where we need to map out how we have a long-term, sustainable future for social care that protects the elderly and the most vulnerable in society and ensures that people do not have to lose their homes and that the people who work in the sector get looked after as well. So we will not have to wait very much for the Prime Minister to set out his proposals.
When you say before the end of the year, did you mean the end of the calendar year, which would be 2.5 years since the Prime Minister made his pledge, or before the end of this parliamentary year, the parliamentary recess, which at least would just be 2 years?
Well, Parliament goes into recess in a couple of days' time. We've said in the past that we would be bringing forward the proposals before the end of this calendar year, but I believe we will be in a position to set out proposals much sooner than that. But, Trevor, I'm afraid you just have to wait a little bit longer. All I can say to you is that all of us who are involved in this care very much about it. I think it's one of the most important generational issues that we have to tackle as a country, and we'll be publishing proposals soon.
Mr Jenrick, thank you. You know what a patient person I am. Obviously, not everybody is as patient as me. We'll see when that plan arrives. Thank you very much for your time.
Thank you.
Robert Jenrick there. Well, let's get some reaction to what we've just heard from Labour's Shadow Health Secretary, Jonathan Ashworth, who joins us now. Mr Ashworth, do you think that Robert Jenrick has a case that the Chancellor and the Prime Minister they've been pinged and they basically just have to do what they're told, and it's just unfortunate?
I think there'll be parents across the country who have struggled this past year when their children have been sent home because they were in a bubble and had to isolate. There will be workers across the country who have to isolate when pinged, including in public services like the NHS. And I think for many of them, waking up this morning to hear that there is a special rule, an exclusive rule for Boris Johnson and Rishi Sunak, they will be saying to themselves that this looks like one rule for them and something else for the rest of us. Nobody understands how you can get access to this special treatment, this special VIP lane where you don't have to isolate yourself. If it is a pilot, why can't employers apply for their workforce to be members of this pilot? Why can't schools have applied to be part of this pilot test? I really do think a lot of people are going to be looking at this and thinking, what on earth is going on? And of course, this is at a time when we need to maintain confidence in the isolation policies, because isolation, taking yourself away from society if you've been in contact with someone who's got the virus, is one of the key ways in which we break transmission. And of course, we know that infections are rising at the moment.
Let's be fair here. If it were Sir Keir Starmer in number 10 and you were the Health Secretary, you would be coming on here and saying, look, the man is the Prime Minister. Of course we have to take special steps because he runs the country and we can't have the Prime Minister inhibited from doing his job.
I'm not sure how the Prime Minister joining Zoom calls from his office in the flat above Downing Street inhibits him doing his job, to be frank. He's still able to use the telephone, he's still able to use a computer, and he's still able to join a Zoom call, as lots of us have had to do in these past 16 months throughout the crisis. I think why it sticks in people's throat is that apparently there is this special system, this VIP system that somehow some people can get onto, where they can avoid isolating if they've been pinged. Now, if there is this system, then other people should be able to apply for it. Other employers should be able to apply for it and ask for their workforce to be considered. That's not the case at the moment. So it looks like for a lot of us, it is indeed one rule for them at the top and another for the rest of us.
OK, well, let's just talk about the actual policy rather than the politics of this morning. There are a number of things which are in the air. For example, the proposal for test and release, a version of it supported by your former leader, Tony Blair, this morning, i.e. that people who can be tested every day, and if they're negative, they can get on with their jobs. Would you support that being applied across the population?
Well, SAGE are looking at it, and I think we should wait and see for the SAGE final analysis of it. Of course, the problem with people getting pings, the problem with people being asked to isolate, is that is a symptom of increased transmission in society. Now, we know that we've had over 50,000 cases. We know that the virus is climbing again very steeply. So what you've got to do is put measures in place to break transmission chains. But instead of doing that, we're about to have Freedom Day tomorrow, where the government, where Sajid, Javid and others are effectively putting their foot down on the accelerator and throwing off the seatbelts, because precautionary measures like mask wearing, like encouraging people to work from home, like paying people decent sick pay, are not being implemented. I think that is a mistake.
Oh, so let's get this clear. So when you and other Labour spokespeople have been saying for the last 2 or 3 weeks you don't oppose Freedom Day, what you really meant was that you do oppose opening up on tomorrow? No,
we want to proceed with caution. And I would have an approach which is about protect.
What do tomorrow then? So, just to be clear, what would you not do tomorrow?
Well, I would not get rid of the mandatory mask wearing. Look, people will want to do the right thing, and they'll want to wear masks, but they want to be reassured that in return that they are protected by others wearing masks. But getting rid of the mandatory rule, I think, is too much of a risk. Tomorrow we're likely to see possibly the busiest day on the transport networks for 16 months, with people going back to work. I would say allow people to continue to work from home if they want to. I would say let's mobilise British manufacturing to build air filtration units to put in our schools and our premises. I would pay people sick pay, and I would prepare for the future by investing in the National Health Service now, and because we know come the winter...
Mr Ashworth, everything you've just said is pretty much what Conservative ministers come on here and say. So other than moving from mandatory mask wearing to voluntary mask wearing, which surveys in the last few days show us that I think 3/4, maybe more of people will do anyway. That's the difference between you and the government.
No, and with respect, I haven't seen Conservative ministers coming on the news programme.
Let me assure you, you obviously haven't watched the programme, but that's what they've been saying, pretty much what you've just said.
They don't talk about sick pay. They don't say they're going to fix sick pay. They don't say they're going to give people the right to work from home should they want to work from home. They don't say they're going to use British manufacturing to build air filtration systems to put them into schools. And they're certainly not preparing the future by investing in the NHS, or indeed looking at our testing capacity and seeing if we can invest in our testing capacity to start testing for flu and other respiratory viruses this winter as well. So there is actually a difference between the Labour Party and the Conservative Party. Of course, our proposals are backed up by SAGE, and indeed are backed up by a report from the Academy of Medical Sciences last week. The government's proposal is to just go headlong into this throwing Freedom Day, throwing off all restrictions. That risks increased pressures on the NHS, and we're already seeing cancer operations cancelled, even liver transplant operations cancelled in Birmingham, I think it was. But it also risks a new variant, because when you have a pool of infections in society, an increasing level of infection, and you have a partially vaccinated population, you're putting a selection pressure on the virus to mutate. And the big risk is we could snatch defeat from the jaws of victory, if you like, and be set back, and the vicious cycle starts all over again.
All right. I just want to keep seeing, what the Labour Party, were in government, would do differently. One other area of policy where you might do something different is on the pingdemic, if you like, the pingocracy. There are those who say that we should just drop the app, or that we should essentially tweak it. Your former leader says this morning that actually we need to adjust it so fewer people are pinged. Would you have it desensitised or dropped?
Well, again, the problem with the pinging isn't the pinging in itself. That is a symptom of transmission in society, and infection rates are increasing, which is why we would put in place those containment measures to slow the spread of the virus. And that is a material difference between us and the government. We would also, by the way, do more to drive up vaccination rates amongst younger people, because we really need to get younger people to take the vaccine. And of course, we would ask. The speculation is the JCVI are not going to propose vaccination for adolescents. We're doing that in other countries, or they are doing it in other countries, in the United States, in parts of Europe, and so on. If that is the advice from the JCVI, then I suppose that is the advice. But I would really ask them to carefully consider whether or not we should be vaccinating teenage children in this country. We need to take a number of measures to really drive infection rates down, to stop people catching the virus and to stop people being contacts of those with the virus.
So just very briefly, you are against vaccinating children?
No, I'm not against vaccinating children. I think it needs to be looked at by the JCVI. If other countries are doing it, I don't understand why we are not proposing it. But of course, in the end, these are always clinical decisions. But if the JCVI are going to propose tomorrow that we should not vaccinate children, I hope they can fully explain their thinking and why they've taken a different decision to the United States, for example.
Thank you very much, Mr. Ashworth. OK. We spoke earlier in the show briefly about social care, one of the major issues that the government's grappling with. We're approaching Boris Johnson's 2-year anniversary, as I said a moment ago, which means it's almost 2 years since he pledged to fix the problem once and for all. But unless we've all missed the memo, no plan has actually emerged, so others have stepped in to fill the void. And one of those is Damian Green, the former Deputy Prime Minister, who's backing a new plan announced today. Mr. Green joins us now. Damian Green, just before we get on to your plan on social care, can I just ask you, Ashford, which is your constituency, is the main station on the way to France, if you're going by train. Are you convinced that the quarantine requirement about France, even for people who are double jabbed, is absolutely necessary?
I can see the reasons for it, and sadly, we're not the main stop at the moment because Eurostar traffic is down so much that they're only running services from London at the moment, so it has no direct effect on my constituency. What will have an effect is getting travel back normally as fast as possible so they can reopen their full services.
But it's part of a general point, isn't it, that actually the balance between what the local government secretary described as caution or being precautionary and getting the economy going again, has the government got this right, do you think?
I think the French decision is reasonable. I think sometimes when you have to take decisions quickly, shortly before they come into effect, that causes problems for people. But I think this sort of old debate about the balance between the economy and infections is a slightly false one, in that what we all want, particularly what business wants, is some kind of certainty that when you take an unlocking step, you're not going to reverse that later on. And what we've learned throughout this pandemic is that a degree of caution for a time is worth it, because that makes it easier and more sensible to unlock permanently for the future. But we're, as everyone says, we're not out of the woods yet. The infections are rising as they're expected to do. I think it is a good idea to continue with Monday's unlocking, because, as Chris Whitty said, if not now, when? This is the best time of year to do that. But nobody should think we're on a sort of one-way path to unlocking if we don't all continue to behave responsibly.
OK, let's talk about your proposals in relation to social care. What is different from what you want to do, from what Sir Andrew Dilnot proposed, that set a cap, for example, on what we'd each have to spend at about £50,000?
The big difference in this report from Public Policy Projects is that instead of having a flat cap of say, £50,000, we suggest that it should be a percentage of your assets. Now, for most people's assets, that's broadly speaking their house. And the reason why having a flat number is difficult to implement, it's why the Dilnot proposals have never been implemented, is that it has widely different effects in different parts of the country. In parts of the country where house prices are much lower, then £50,000 will take a significant chunk out of your estate. In other parts of the country, it won't. So it's geographically unfair if you just have a flat number. If you have a percentage figure, say that you can, wherever you are in the country, keep 70% of your assets, we think that's fairer and therefore more politically palatable for a decision which is going to be difficult. Whatever means you try and raise the money, it's difficult, because people are going to have to pay more than we have done in the past, because the social care system is underfunded to the tune of something between 7 and 10 billion a year.
So, first point, to be clear, you are now essentially accepting that in order to fund social care, people are going to have to sell their homes.
No, I'm not. Absolutely not. That's the whole point, because if you can keep a measurable percentage of your assets, then you won't have to sell your home. You can buy an insurance policy or something like that, maybe using features like equity release, so that you can actually use the value of your home but not have to sell it. And I think the difference between the PPP proposal and the Dilnot proposal is that everyone will know that one of the examples we use in the report is 70%, that 70% of their inheritance, if you like, is guaranteed for their children or their family, whereas under Dilnot, the percentage that you might be able to pass on is wildly different in different parts of the country.
Well, let's just examine this point about fairness, and I wonder if you could explain it for us, because the average London householder under your proposals would still have, whether they take out insurance or they borrow or whatever it is, they'd still have £337,000 in the kitty after hitting your proposed cap, compared to someone in the North East who'd have just £92,000. And someone in your own constituency, Ashford, would be left with £140,000. How is that fairer?
Yeah, I did the calculations on the basis of Ashford versus Hartlepool. And in my constituency, the average house price is £370,000. In Hartlepool, it's £130,000. If you have a £50,000, £60,000, £70,000 cap, all the sort of figures that have been mentioned, then in Hartlepool, you're losing more than half your inheritance. In Ashford, you're losing a much smaller proportion. And
but you're still left with a lot more actual money.
Well, but because for the way the housing system works, and there's a whole other argument to be had about planning, but the way the housing system works, it just means you are when you're alive, you have a lot more wealth, you have a lot more asset, just because the same house in different parts of the country is worth different things. Now, to solve that requires a lot of change about planning and indeed levelling up, so that house prices go up in other parts of the country because they become places where people want to move to. But that's a longer term thing. In the meantime, what you can do now is to say wherever you are in the country, you get to keep the same percentage of your assets, so that you will know roughly what your house is worth, and therefore, if you're thinking about what can I leave to my children, then you will know that you've got the bulk of that to leave.
You've been in Number 10 for quite some time as Deputy Prime Minister. You were a minister in other departments. Has the Prime Minister made the right judgment today to work from Number 10 under this pilot scheme to which it appears every cabinet minister has access and hardly anybody else does? Well,
it's not clear who's got access to it. But yeah, I mean, I think in practical terms, allowing the Prime Minister and the Chancellor of the Exchequer to work as normally as possible is actually quite sensible. And I hope one of the effects of this is to accelerate the pilot scheme, and indeed the analysis of the pilot scheme, because this might be a way out of the current problems of people not being able to go to work. I think the sooner we get to that, the better, and clearly daily testing is one way to achieve that. So I'd be very keen if we could move to a system where if you have been in contact with someone but you're showing no symptoms and as far as you know you haven't got it, then regular testing should replace isolation. I think that would be a significant unlocking step, and it would be very welcome.
Damian Green, thank you very much indeed. Now, we all know that the pandemic has changed the labour market. Furlough, working from home and, unfortunately, job losses. But what's received less attention is how many people who have kept their job have seen their working conditions altered, many say against their will. Now a campaign is underway to clamp down on so-called fire and rehire, the process of forcing workers onto worse terms and conditions. This week, we've been investigating the issue. Amina Patel is a social care worker in Tower Hamlets in East London. For the last 3 years, she's been employed by the council to look after elderly members of her community. But last July, her contracted work was changed. An active member of her local trade union, Amina says that she and her colleagues are victims of a growing trend amongst employers known as fire and rehire.
These contracts that have been imposed make us workers worse off. The main thing with the contracts in Tower Hamlets is a reduction in severance by 80%, cuts to travel allowance. For myself, I'm a low-paid worker, so for me that's a reduction of £596 to my salary. Makes you feel disrespected. I think that's the biggest part. We were, so many of us in the council, like myself, we've been key workers, we're essential workers. We've been working from home, going out doing visits, where we absolutely have to, wearing the necessary PPE. But then at the same time, you've got people clapping on Thursdays and you've got the council clapping, but then you're being fired and rehired and being put on worse contracts. That makes your terms and conditions much worse.
The dispute doesn't seem for you to be just about money. It's about who you are.
Of course. For myself, I'm a lower paid worker in the council, and it's just, is this the gratitude that you get for putting your life on the line during the pandemic to support the community?
Tower Hamlets Council say the new contracts were only introduced after a long period of consultation. The severance package, they say, remains one of the most generous for council workers in London. It prevents big payouts to high earners, and any money saved has been reinvested into pay for staff. But this issue goes far beyond one employer. Research by the TUC earlier this year found that 9% of workers have been told to reapply for their jobs on worse terms and conditions since the first lockdown in March last year. That figure doubles to 18% for young people aged 18 to 24. And workers from minority ethnic backgrounds have been almost twice as likely as white workers to have faced fire and rehire, with 15% saying they've been affected. And there's been widespread criticism of the tactic, including from the most senior Conservatives.
We believe that using threats of firing and rehiring is unacceptable as a negotiating tactic, and there are laws in place to ensure that contractual conditions can't discriminate against people on grounds of race or sex or disability.
Now, a former Labour frontbencher is trying to change the law. He's proposing a bill to clamp down on fire and rehire.
It's to stop managers intimidating the workforce by saying, you're fired, but if you want your job back in the morning, you have to sign these new terms and conditions which are going to cut your pay, cut your pension rights, and going for the nuclear option right from the beginning. What I want to see is proper consultation, proper negotiation. I want Britain to be the best place for people to work, not to have this bully boy tactics. I'm talking about some workers who were told that this was going to be £12,000 off their annual salary. I'm talking about, teachers who were told that it was ripping up their pension rights. So we do need to see that this is something that shouldn't be happening. And I'm pleased, actually, that, if you speak or listen to Jacob Rees-Mogg and Boris Johnson, they've both said that this is unacceptable. Trouble is, they've so far not been willing to legislate.
Why do we need law on this? Surely this is one where, as you were saying, we get people round the table, try to engender some trust, talk about it.
The issue is this. No employer believes that it is morally right simply to say to your workforce, you're fired, you accept £15,000, £20,000 off your annual wage, or you're out. There's no question about that. They know it's morally wrong, but because the law doesn't give them any duty to negotiate and to consult, they don't.
Most of the employers who are in dispute in this situation tend to say the following. We've been faced with COVID. We're faced with technological change and disruption. We've got terms and conditions that have lasted, 5, 10, 15 years. In the end, we're left with a choice. Do we declare redundancies? Do we just collapse the company? Or do we try to get new terms?
Many of the companies who are doing this have actually made record profits during the COVID pandemic.
In response, the government says, we are absolutely clear that using fire and rehire as a negotiating tactic is completely unacceptable, and we expect companies to treat their employees fairly. If an employer needs to make changes to an employee's contract, they must reach a formal agreement with that worker or their representatives. We've asked ACAS to produce clearer and more comprehensive guidance for business. A government-commissioned review already carried out by ACAS found that there may be an increase in fire and rehire when COVID economic support measures wind down, a process that began this month. It's a reminder that workers losing their jobs hasn't been the only result of the pandemic. Even for some of those still in work, things are feeling very different. In response to our inquiry, Tower Hamlets Council sent us this statement. We have consulted extensively with our staff since January 2019 and introduced revised terms and conditions in July 2020. Among the changes was a reduction to our severance scheme, which remains one of the most generous in London local government. The new terms and conditions mean money has been diverted back into improving pay for staff working for the council. No staff are on worse conditions or pay or have been dismissed as a result of the changes. And we think they offer a fair deal for our valued staff. Now, today is Nelson Mandela Day, and it comes at a time when many South Africans may be looking at the state of their nation and wondering what the world's favourite revolutionary would make of it. The jailing of former South African President Jacob Zuma earlier this month sparked widespread riots and looting, with well over 100 people killed. It's the worst unrest seen in post-apartheid South Africa. So where does the Rainbow Nation go from here? I'm joined now by equality campaigner and the eldest daughter of Nelson Mandela, Dr. Makaziwe Mandela. Good morning, Dr. Mandela. What is the message of Nelson Mandela Day?
The message of Nelson Mandela Day is about working together to address the inequities, to address poverty, to do everything as individuals to create a better life for somebody else. That's the message of Nelson Mandela Day, because no one person, no one organization can actually be able to address the social injustice, the poverty that is in society. You need a lot of people to come together, individuals, organizations, government, to try and change this world to be a better place for all.
We're a long way from the action that you're seeing, some of it extremely unpleasant. We'll come to that in a moment. But what would you like people out here in Europe and North America to be doing to celebrate this day?
I think for me, Trevor, as I look around the world, we have the COVID, which is plaguing a lot of people. And just as I listen, a lot of people are losing their jobs. And there's a resurgence of racism and ethnicism around the world. I think COVID has exacerbated the inequities in society. And I think Nelson Mandela Day is about reminding us of the challenges that are ahead of us. And I think for me, COVID-19 has shown that humanity is capable of actually helping each other to try and create a better environment society. And that if we are not going to work together and hold hands, whether it's in the sort of rich north and emerging south or the west, we all need to work together. Basically, I think that's the message of Nelson Mandela International Day.
Well, you talked about the scourge of COVID, and over the last year, it has been the greatest challenge to South Africa. And across Africa, actually, infections have surged by about 43% in the space of a week. What does Africa and South Africa in particular need in order to be able to meet that challenge now?
I think the most important thing, as we've realized, is that we need vaccines. And because the rich West or North has actually bought all the vaccines, the emerging economies have very little of the vaccines. The social distancing, I think South Africa did well in the first phase of COVID, and to some extent, a little bit better in the second wave of the COVID. But that third wave is becoming more brutal on society, mainly because, we have a lot of people who are in poverty, don't have the same access to health. And, vaccines are very scarce around the world. And so we are faced with multiple challenges in South Africa. And the world could help Africa in terms of vaccine and allowing some of the vaccines to be manufactured in Africa.
Can I turn to some more divisive issues? We've seen over the last year a wave of concern, anxiety, protest over racism. A year ago, the whole world was talking about Black Lives Matter. What do you think your father would be saying about all of that were he alive today?
I think my father would be repeating what he said when he was alive, that the struggle is not actually complete and that we should not tire. We should press on to fight racism with everything that we have in our might, and that there needs to be much more dialogue on racism because it's plaguing the whole world. America, UK, South Africa, we still have a lot of after effects of apartheid that we are feeling. It's in Europe. I think my father would be saying, we've got to all put our heads together and fight this scourge of racism until it ends.
Let's turn to South Africa itself today. I was on television doing this job many years ago when your father came out of Pollsmoor prison, and I commentated on it with Thabo Mbeki, who became his deputy and the first president. And I don't think on that day anybody imagined, though we knew things would be difficult, that South Africa would be where it is today. question I really want to ask you is this. For the last 27 years, the movement that your father and Oliver Tambo created, the African National Congress, has been in government. How much of what is happening today is the ANC's responsibility?
I would say all of it is actually the responsibility of the ANC. The ANC seems to have forgotten why it came into power. It came into power mainly because it wanted to improve the conditions and lives of Black people who have been impoverished, their dignity taken away by the apartheid regime. Political freedom was never enough. My father knew it, they knew it. And we cannot leave the economy that supported apartheid to be intact because there is no way, therefore, to redress the inequities of the past and address the conditions of the poor. I mean, if you look at the conditions of the poor in South Africa, who are mainly Black, it has not improved. Alexander, where my dad stayed when he came to Johannesburg, is still the same. It has not improved. Simple things like providing adequate housing, water, clean services has been something that this government has failed actually our people in terms to deliver. And so what is happening right now is squarely in their hands. As my father said before with apartheid, they cannot go on forever looking at peaceful means and the government doesn't hear. Those who are poor, who have not benefited from what I call the post-apartheid dividend, have been poor for more than 300 years. Their father, their generations, their grandfather, their great-grandfather. How long should they wait until conditions improve for them? Nobody, Trevor, I want to assure you, wants to see South Africa in a situation of violence. But unless South Africa squarely address the issues of poverty and inequity, youth unemployment, which is hovering at about 74%, South Africa will see more of this violence occurring more and more.
Dr. Mandela, thank you very much indeed. I hope today is a good day for you, at least.
Thank you. Thank you very much, Trevor.
As we've been discussing, lockdown restrictions in England will be lifted tomorrow. Good news for many business, you may think. But a poll of business leaders carried out by the Chartered Management Institute and shared exclusively with this show has found that half believe the government is lifting restrictions too quickly. 39% believe it's happening at the right pace. 43% of managers said some staff who are currently working remotely will be asked to return to the office. A quarter said they'd ask most staff, while only 13% will be asking all staff to return. Over 3/4 of managers will continue with COVID-19 safety measures in the workplace despite the lifting of restrictions tomorrow. Only 2% will not. And there were concerns about the impact of self-isolation, something we've been discussing this morning. 53% of managers were concerned that the amount of staff self-isolating will impact business operations. 46% weren't concerned. Well, to talk more about this, we're joined by the Chief Executive of the CMI, Anne Francke. Anne Francke, half of respondents think that it's all going too fast. Why? Is there an explanation?
Well, I think the explanation is quite apparent. As we know, cases are surging. They're 50,000, and of course, Britain now has the third highest number of cases in the world. And equally, we also know that many people are being contacted. I think it's up 46% week on week and asking to self-isolate. Indeed, the Secretary of State for Health, for example, has contacted COVID, and the Prime Minister's been asked to self-isolate. So the disease is still very prevalent amongst us, and it is creating a lot of anxiety for many people, including many managers.
It's odd, though, isn't it? Because business leaders are complaining on the one hand that they're facing crisis because they can't get everybody back to work, but half of them are now saying, oh, it's all too quick. What should we really take from that?
Well, I think what we need to take from this is that this pandemic is complex. There is not a one-size-fits-all solution. And what business leaders need to do is assess their own situation carefully and put in place measures that will resonate for their workforce, their employees, and their customers. So, for example, if you are in a workplace that requires people to be on site, such as a restaurant or a hotel, then it makes absolute perfect sense that you should be able to ask people to take daily lateral flow tests and be able to come into work if those tests are negative. If you're in a workplace such as services that can work very productively remotely, well, then actually you should embrace the more flexible working policies. And we know many managers want to continue flexible working post-pandemic.
How do you think business managers are going to feel this morning when they see that, as far as one can make out, Prime Minister and Chancellor can get on with their business, come what may, but frankly, doesn't look like they'll be able to get their people in and doing the jobs in the way they would like them to?
Yeah, and that's where it's very important that things like this pilot scheme to give people the option to take a lateral flow test and go into work, it's very important that that's extended to businesses that require on-site presence. I think that the other thing I would say is that it's really important that employers engage with their employees and set a framework so that people understand what their employers are going to be doing and give the employees a say in that. And recognize there is not a one-size-fits-all solution to how we operate in COVID.
Just finally, one of the most striking things to me in these findings is two of the findings that suggest that changes that were forced by COVID may become permanent. 3/4 say they'll continue with COVID measures, and 2/3 say they expect some or all of the staff to work remotely. Do you think that's the new normal?
Well, absolutely. I think what's a good thing about the pandemic is it's forced us to reevaluate our working practices and in many cases modernize them. We know that 85% of managers would like to continue with hybrid working. Indeed, 83% are working hybrid at the moment. And that actually can be a more productive and more enjoyable and a more inclusive way of working. And so really, we mustn't allow the good changes in working practices to slip back to the way it was. We have a great opportunity to create a better workplace culture.
Anne Frank, thank you very much indeed for your time this morning.
Thank you.
That's it for today's show, which is the last one of this series. We're going to take a break for the summer, but we'll be back before you know it in early September. Before that, we've got a little encore for you. Trevor Phillips, The Take, is after the break. We'll be going over everything we've heard today. We'll be joined by a friend of the show, Sam Coates, our Deputy Political Editor. So don't go anywhere. We'll be back in just a few moments.